This is the meeting for the month of May, and I do apologize because I'm experiencing some technical difficulties here, so you will not see me visually today, but I will be here in spirit, in voice as well. So everyone, again, good afternoon. And if you don't mind, if you can place your name, the name of your organization, and our icebreaker for today is, how do you find peace and joy during these uncertain times? And we can just start with that, and everyone could place that into the chat. And those who feel that they want to voice their particular views, then please share that so the group can benefit from it as well.
And I see some introductions coming in the chat here. But I'm curious, Dawn Brown, I see you joined us for the first time. Curious if you'd like to introduce yourself and Maryland Wellness. And I'm not sure if it's just on my end, but your audio is cutting out, Dawn.
Is that a little better?
It is.
Much better, yes.
Okay. Sometimes it'll change your speakers or your microphone, like from one meeting to another. So my apologies for that. But I'm Dawn Brown. I am the Director of Business Development with Maryland Wellness. We are a licensed outpatient mental health clinic with locations really across the state. But in Prince George's, we have an Upper Marlboro location. So we have not been part of these meetings before, and I really appreciate there's been some communication with my colleague Lisa, and we are so glad to be at the table with you all today.
And thank you so much for joining us, and hopefully you will be a part of this group in the future as well.
Yes, we look forward to it.
Hey, any more introductions? Any other new folks who have joined us today? Please feel free to introduce yourself along with your organization as well.
Hi, I'm Jean Drummond. I try to join when I can. I travel a lot, so I'm kind of out of town. I don't know what's wrong with my camera. You see our backdrop, but you can't see me. And hopefully if I can fix this, I will. But nice to meet you. Nice to connect with everyone again. Love Prince George's County, no question.
Wonderful. Welcome back. Anybody else would like to share? Well, you want to go ahead and get started? Shall I get started, Taylor and Christine? Good afternoon, everyone. My name is Dr. Sharon Gibbs Cooper. I am from the University of Maryland Institute for Governmental Service and Research. I am the co-chair of the Health Equity Workgroup. And as far as I would like to call it diversion to what's going on with the changing political and economic landscape, is going out to eat. I find comfort in food. Anybody
Thank you, Dr.
else?
Cooper.
You're welcome.
I'll go real quick, just for those who I have not met yet. My name is Taylor Palmer, and I manage our Prince George's Health Action Coalition. So that's our coalition at large. And then under our coalition, we have 4 wonderful work groups. So we have our Health Equity Work Group that you all are a part of, our Behavioral Health Advisory Group, a Healthy Eating Active Living Work Group, as well as a Community Care Coordination Team. So very excited to see you all and wanted to wish you all a very warm Mental Health Awareness Month, and certainly hope that you all are taking good care this month. And as always, and let us know how we can best support you.
Good afternoon. I'm the other co-chair, Christine Stewart. I live in Prince George's County. I am from the Institute for Public Health Innovation. How I stay sane, I've recently, and when I say recent, I mean only in the last month, gotten into Japanese and Korean dramas, which are very light. When I say drama, it's not drama like we have here. So it is very much a palate cleanser. And I never thought that I would get into them, but met somebody who convinced me to start watching one, and I've gotten hooked because it's light and no drama, and it keeps me away from some of the more serious things that we probably all deal with every day at work. I see there are some other things that people do, meditation, self-care, gratitude, prayer, um, gardening, making, oh my gosh, making your immediate environment more beautiful. I've met a lot of people who've gotten into gardening, and this is a wonderful time of year. If you don't suffer from allergies, watching sitcoms, adult coloring books is another thing that I've also found that keeps me that I want to get into. And also, Sean said the NBA playoffs. Wonderful. And I'm sorry.
Anyone else willing to share at this point? Okay, so I guess we need to go to the agenda. Now that we've gone through the welcome and introductions, next we're going to talk about the Health Assures advocacy updates. And of course, we're going to go to our open discussion, and then we're going to have an update on the Team Black Mamas Matter study, the Health Equity Work Group planning and community announcements, and then we shall adjourn. So next slide. Christine?
Oh, sure. So this is just to ground us all. Each meeting, we like to share our vision, which is a Prince George's County where everyone has equitable access to achieve their full health and wellness potential, regardless of race, color, religion, country of origin, immigrant status, class, age, disability, sexual orientation, gender identity, or health literacy skills. And I just want to say this resonates particularly in light of what is happening across the country. So I just say I'm grateful for a space where we can lift this up as a continued priority. Okay, next slide.
And I can jump in here. Last month, for the past 2 months, we've had this ongoing discussion after reviewing the county's proposed fiscal year 26 budget. And so an area of concern identified from this group was the cut to Health Assures. So for those who are just joining us today, in short, the Health Assures is a program that reimburses our federally qualified health centers. So the federally qualified health centers, also known as our FQHCs, there are 6 in Prince George's County and medically underserved areas. And the FQHCs provide low cost or free of cost medical care to uninsured and underinsured Prince Georgians. And so Health Assures is the primary vehicle for reimbursing the federally qualified health centers at the county level. As you can see, we wanted to put up this graphic so folks could understand where the funding has been and then where it is at in the proposed budget. So here in FY26 in the proposed budget, it is seeing a cut of over $3 million. And so this group being equity minded and talking about the impacts of underinsurance and uninsured status on folks, saw this as a particular problem area. And so what this group identified that they wanted to take on as a next advocacy step was to draft a letter of support for the Health Assures program and write that letter to our council members here in Prince George's County as they consider next steps in the county's budget. So wanted to give some updates as to the advocacy efforts, where that letter has went, and the testimonials that were provided a few weeks ago at the most recent budget hearing, and keep you all updated on where the budget is at and when we could see the effects of this advocacy effort. So for those who are not familiar with the budget adoption timeline here in Prince George's County, here's a graphic that the County Council has put up. Here we are here and now at May 15th. So the budget went to the county exec's office. Those negotiations were supposed to wrap up today, actually, and then between now and early into next week, the draft of the budget document will happen. So that process will start very shortly. And then the final review of the budget will take place come the 21st. And then on the 29th, we will see the adoption of the final fiscal year budget. So this is something for us all to keep in mind. We should have updates to see if Health Assures will get increased budget item very soon. So I will keep you all posted come the 29th if I hear of anything. But here's where we are at here now with the process.
And I would just like to take the opportunity to thank Sean for crafting that letter and taking the lead on that, and those who provided input to helping to shape that letter. It was definitely impactful and effective. And I would also like to thank folks who were either present or provided testimonies during last Tuesday's council meeting. It was, as I want to go back to say, impactful because we had a variety of folks who not were only were the service providers, but those who were directly beneficial or benefited from these particular programs. And it showed the true value that these programs bring to our communities in building this culture of health that we're trying to create within this particular beautiful county that we reside in and work in. So thank you very much for all those who participated and supported this effort, whether it was through the support of the letters, sending out to your local council people, speaking with those who could possibly help to advance this message forward, those who were, again, testifying and providing the information that could, again, help heighten awareness about this important issue. So thank you all.
And we can provide the link here if anyone is interested in hearing that public hearing. The comments that, again, were provided. I believe we had 3 federally qualified health centers in attendance to talk about the impact of Health Assures and what this cut to funding would look like for their organizations and the care that they are able to provide to the community. So we will provide that to folks. And then, of course, if anyone, if you weren't involved in the effort but would like to review the letter and see what was sent to the council members and also read at the budget hearing by Sean, we are happy to share that letter with you as well.
Sorry to jump in here, Taylor. I haven't had a chance to respond to your email. Been so crazy busy, but I do see that you were asking me to send it to the executives, the county executives, so I can definitely do that by tomorrow if it has not been done already. I apologize.
No worries, Sean. I think we may be out of town or be out of time regarding the county exec, just because I think this was between the 9th and the 15th was going to be the time that the council was with the county exec for those budget negotiations. But feel free, anyone correct me if I'm wrong. The letter can still, of course, go to the county executive. If anyone knows a little bit more about the process here. And I believe the federal.
I'm sorry. I wish I could be seen, but even if we missed the window, I'm quite certain it wouldn't hurt to send that letter to the county executive anyway. To let them know that we had good representation at the council hearing, and certainly we know that this is an issue on the heart of Prince George's County, and I don't think it would hurt at all.
I agree. I think that you should send it anyway. And there's always last minute things that happen, and you never know. Maybe that's the letter that pushes somebody over the edge into making consideration where they hadn't previously, right?
Even to say that the eyes are watching. We could even send something like that to the council members. We're really serious. We want you guys to give your full attention to this and your support. It doesn't hurt.
Yeah, I can definitely do that. And I will say at the hearing, they took a moment, for those who weren't there, to kind of acknowledge the community support that's going towards this health assurance bill. So I'm hoping they're on board. But yeah, like you're right, more would not hurt for sure.
And I thought it was also important for them to be able to see this through the lens of those who are directly out there, our frontline folks, our individuals who are directly benefiting from these services, and how this, particular effort has, sustained lives and improved the quality of lives for people. And even the steps that were taken during COVID-19 and the number of individuals served. So hopefully, I think it was, I thought, again, it was impactful. And I thought it really gave them an idea of what community members effectively being able to express the needs and giving them a clear picture, because sometimes when we're in certain positions, we don't actually understand the impact or value of such programs and how it does have implications to our community as a whole. Mm. So what are our next steps? And I see, thank you, Taylor, future engagement with Health Assurers Workgroup. And are there any updates that anyone would be comfortable in sharing at this particular time?
And I'm not sure, is that the official name of the work group? I know, I believe Sharon, you're part of the work group, and what is the frequency of those meetings? Are you all meeting monthly, or?
We meet every 2 weeks, and it's the task force. It's a county council established task force on equitable access to primary health care. And the goal of, and it's a legislated task force. The goal of the task force is to address the immediate needs, which is this year's the FY 2026 budget and the reduction in funding that was proposed. And then the second part of it is to discuss how to develop a more robust program, which they want to rename Prince George's Cares, similar to Montgomery Cares, and how to build a program that's both sustainable but expandable, to cover those people who are low income and ineligible for insurances. And I would like to add here that there's always some discussion about, well, it's the state's responsibility. So based on what I'm hearing at the federal level, one of the changes to, or one of the proposals related to the FMAP, the federal contribution to Medicaid, is that the FMAP will stay in place, but if there are states who are providing coverage, even if it's through their own dollars, to undocumented immigrants, that their FMAP will be cut back. And that's a huge issue for the states. So when people talk about the state's responsibilities, certainly during the next several years, it is the localities that are going to have to take responsibility for ensuring or providing access to care for low income, uninsured, and uninsurable residents. There is nobody else to turn to at this point.
If you don't mind, may I ask two questions? The acronym FNAP, can you tell me what that stands for? And then two, FNAP or the task force, is its history out of providing services during the pandemic and they were able to be sustained and now we're at the crunch point? Is that kind of accurate? I can't hear you. Did you mute or was I muted?
I was muted, sorry. The FNAP is the Federal Medical Assistance Percentage.
Okay.
In Maryland, and that's the part of Medicaid that the federal government covers.
Why? Okay.
In Maryland, it's 50% for the traditional Medicaid population. And for all states, including Maryland, the feds cover 90% of the ACA expansion population, which is basically adults, low-income adults who are on Medicaid.
MA. Okay. Yeah. Okay.
So any reduction to that really places a huge financial burden on the states.
Right.
And then the other question was about Health Assures. Health Assures started before COVID, but it was funded at a very low level through basically the kindness of the health department's heart. They took
Right.
funds from their budget and were providing reimbursement to the health centers for some percentage of the uninsured patients that they were serving. And it increased during COVID using COVID funds because the county, number one, they were relying on the health centers to do some of the work related to testing, education, and management for uninsured people who had COVID. And the funds were there. There was a significant influx of federal funds to address COVID. So and it's the American Recovery Act funds that were being used. And once they went away, they were like, well, we don't have any more money, so we're going to allocate $1 million and hope for the best. And today, the best, we need to do better than the best because we have no other resources.
Right. Okay. Thank you so much for the backstory here.
And it's also important to note, like you see, like, it was a $5.6 million, at its high in COVID, dropped, here to 5 million when it was being sustained by those ARPA funds.
Right.
But you also have to note that this Health Assures is usually fully expended within 6 months of the fiscal year. And so the county starts July 1. So, by January to March, those funds are already expended by, and that's at full funding. That's at with 5.6, 4.2, being at a cut of 1 million.
Wow.
There's really no telling what that will sustain.
Taylor and Sharon, this is Judy. I have a comment of these health centers that QHCs do. Please remember that when they see a patient, there's a lot of wraparound services. And I know that Sharon would know and understand this, but maybe others don't. There's a lot of, it's not just that they see the patient comes in and they see them for 10 minutes and they go. It's a much broader and much bigger impact of what these health centers do for these patients. And everything from the SDOH screenings to mental health screening. I mean, it's phenomenal, the breadth of what they do for these patients. So I just wanted us to understand it's not just a quick doctor's visit. It really is significantly more.
So I
think we tried to convey that in the letter that we sent, that we put together, exactly what you're sharing, Judy, just because I think there's a recognition that it's not just a doctor's visit. There's so much more, and they get so much value by supporting and reimbursing the health centers. Sorry,
Yep.
Sharon.
I was going to say, I would add, the goal of the health centers, and Judy alluded to it, it's not acute care. We want to create a medical home for people so that the goal is to enroll a client and keep them coming back over and
Yeah.
over again so that they can manage their chronic illnesses and get linked up to resources to address the social determinants of health and do all that stuff. So by
That
not
sounds like
funding,
some case management, right?
by not funding
Mhm.
those services, especially in these uncertain times, it really jeopardizes the ability of the health centers to maintain their services and in some cases to maintain their facilities here in the county. The county's really lucky to have 6 FQHCs within its borders. And, if anything, particularly in this uncertain time, we would want to see them expanding and not contracting.
Absolutely. And it addresses the primary care models that many of these hospitals are advocating for. These emergency departments are overwhelmed with individuals using the ED as their first continuum into the healthcare system. And with these healthcare providers through Health Assurers, it alleviates that unnecessary traffic coming through there. And it provides that I would call warm handoff after folks are discharged from the emergency departments. So again, when you look at the infrastructure and the total value that the Health Assurers programs and health centers provide, again, you can't negate or sacrifice health. And this helps to, again, build that community and that culture of health. And it helps us to also look at how we can do that holistic approach in managing preventable diseases so it doesn't escalate into something more serious, not only to the individuals being served, but to the cost of the healthcare system as well. So again, I thank you to testify and those who supported this effort through this work group. This is really challenging times, and I think our sphere of influence goes beyond this work group. We can see that it's something that is notable with the communities that are being served by this group and those healthcare centers.
And so, Sharon, I'm curious in terms of the task force for equitable access to primary health care, how do you see this work group possibly contributing to that work group? Are there best practices that the work group can advocate for or help to research or have a voice at the table, or could you keep us updated on a monthly basis with what is happening within that task force?
So the task force is composed of, I think it's about 20 people representing providers, hospitals, schools, the public schools, and also members of the finance, budget, and Department of Health teams right now. I don't think right now that there's anything that the work group could contribute except support as needed, as you did. I mean, I think the letter was very, very helpful. And it may be as we progress further in our work on how would you build out the system, this would be a good group to maybe survey to see what your thoughts are on what's important to include in Health Assurers as we're looking at building it out, and how would we reduce barriers to people utilizing services. And I think that this group would be really appropriate to comment on that because, even with the health centers, there are still barriers. So how would we best look at that and reduce those barriers to care? I am happy to update on a monthly basis, and I'm also happy to recommend that when we start talking about those conversations, that I volunteer this work group to participate, if you all don't mind.
Can it still work? Thank you. Anything else on health assures?
I see Sean's comment here about that task force. Is the task force open to the public? Are folks able to attend the virtual meetings or be a part of the task force, or is it closed to the council and other
Yeah.
partners?
Folks are able to attend. They're just not, it would be non-voting members. They're open meetings, and the minutes are publicly posted. So I can send you, I have to look it up, but I can send you the link. It looks like
Sharon, can
somebody
you
put
check
it
to
in
see
there.
if see if what I put in there is, I believe it is, just let me know.
Yes, that's it.
wrong.
Yeah.
Okay.
Yep. So you can go to that link and you can participate. And it's every other Wednesday usually from 1:30 to 2:30.
And is anyone else on the work group a part of I believe it's a county council mandated task force for ED wait times? I'm curious if there's been any synergy between, talking about equitable access to primary health care and then the ED wait times, because the two are so interconnected and we almost need to communicate between those groups. Is anyone on the health equity work group a part of the ED wait times task force?
I'm looking at the membership and I don't see
Yeah,
much overlap. Yeah, I don't see
I think
overlap
that
here.
group is mostly hospital folks, and probably like the CEOs of those hospitals and a couple of physicians. But I think for the most part, it's people that are like part of have association with HSCRC. So
Yeah, you can see the membership of that task force at the link I just shared.
So there hasn't been as much cross-pollination maybe as there should be. I mean, and the ED issue is it's more complicated just than the number of people that are coming into the ED. It really has to do with hospital systems and throughput of patients and a whole lot of other stuff that they need to talk about and address that doesn't really involve people coming in the door. But there does need to be a space where that happens, because there is an interaction. There are interactions that would be helpful. I'm not sure how that crosswork would occur because there's no mechanism for it right now. So maybe this group would like to have somebody from that task force come and speak about what they're currently discussing doing, whether they've had any conclusions. It might be that there's a chair or a staff person who might be able to just come and talk about that. And it would provide an opportunity for people to share their thoughts about what might be helpful.
Thanks for that, Sharon.
That's a
Yeah,
good
I know there
I think that's
is.
a good idea.
I know University of Maryland Capital Region Health. I know they're active in the ED wait times task force, and I know on this work group we have some representation from Luminous as well. So I will do some background work and see who we can connect with and learn more and see if that's something that we can incorporate in these monthly updates, and see if there's any cross contamination there or anything that we would like to follow up on.
Cross contamination.
Taylor, I'll be more than happy to follow up with Nate Richardson and his chief of staff at the University of Maryland Medical Systems, because in our last meeting, we did talk about the ED. And one of the things that was communicated, that quite a a high percentage of those coming in were those not requiring the level of care that was designated for ED visits. And so when they go through the triage process, as far as the level of severity, they didn't meet that criteria. And so that's just, I think that would be very beneficial to having someone from his team to come in and speak about that. So I can reach out to them.
You, Dr. Cooper, and seeing Deborah's comment here that the task force just began meeting. Their first meeting was the end of March. So a good time to, introduce ourselves and then also learn more about that task force. So we will keep that on our radar moving forward, and then look forward to hearing some updates from Sharon as the task force takes off as well. In terms of our next steps, it sounds like Sean will work to get some contacts for the county executive's office to get that letter still on their radar as negotiations, I'm sure, continuing and as the budget is finalized. Any other next steps or anything else that anyone would like to follow up on regarding Health Assures? Alrighty, well, we will go ahead and jump into some open time for discussion. Moving forward during our monthly meetings, we do want to hold space to discuss any federal executive orders involving diversity, equity, inclusion, justice, accessibility that impacts us at the federal, state, or local level. So that's kind of how Health Assures got brought up when we were talking about our concerns with different federal mandates, and then the budget came up. So I'm curious if anyone has anything that they would like to share or discuss today.
I have something I'll share. Well, just representing a nonprofit, we've decided to stop applying for federal grants just because we serve a lot of people that the federal programs probably are not okay with. So with that being said, also another thing is just the fact that I went to a women in lead. It wasn't a specific. It was a, how do you say, not a webinar, an in-person discussion at Montgomery College a couple, I want to say about a month ago, and it was all of these higher up C-suite levels from different nonprofits. I think you had Casa de Maryland, we had Maryland Latinos Unidos there, and they were talking about just the usage of the verbiage of DEI in terms of like when we're talking out to the community and presenting. And they seemed on the side of we should not shy away from using that language because it's really just so important to keep diversity and equity, inclusion, and accessibility at the forefront of these things. So I was just bringing that up because I don't know how other people feel about changing the language that they use when it comes to maybe just talking with county or state level or federal level. I'll leave it at that.
Yeah, thank you, Sean, for sharing that, because I think one of the reasons I wanted to bring this discussion to the group is to see what else, how are other nonprofits, hospital systems, et cetera, handling this in the area. I know my organization has these conversations on a daily basis, and we're considering what we won't apply for anymore. I think one thing that we're finding, it's one thing to say we won't go after federal funding, but even obviously federal funding then trickles down. So we're talking about associations that may receive federal funding, associations at a national level, even our states, even some state level contracts we've started to see because the state receives money from the federal government. There have been some very concerning limitations on the language that we are allowed to use. I can go through some of the But I just wanted to see if others are experiencing the same thing. And these are existing contracts, so we're not talking about new stuff. And, you know, when we're talking about state, we're talking about state of Maryland, which actually surprised me. But again, when you look at the source of the funding, they're having to, we're assuming, doing preemptive compliance. They're not sure what it seems like they're not sure what the limit is, but there's concern, and it's causing a lot of,
I don't
think
want to
the
cut,
message is, go ahead, John.
and not wanting to cut anyone off, but I have my own nonprofit, but I don't deal with the contracts and the funding and the grants, et cetera. But I do know that as a nonprofit, I have determined that for me, I've got to stand my ground. You know, I kind of deviating from the subject matter at the moment, but I'm looking at this mess that's going on at MSNBC, and I think that this is perhaps a small snippet of what may be happening through industries otherwise, where that pressure is being made to conform, to acquiesce, and at some point you either stand your ground or you what does it stand for, something, or you fall for anything. So I mean, that may be easy for me to say, the little nonprofit that I have and the work that we do, but I feel it's so essential, especially when the wind seems to be blowing so we've got this tempest that we're coming up against. I really believe it is so important to stand our ground.
I agree. I'm also saying that even in standing our ground, there's going to be repercussion. I mean, there will be. So we know
there are repercussions
we're
already.
talking
Yeah.
about presentations that there's
Yeah.
on present and primary data on primary data, like limitations, and what is the word?
We're losing you.
Not editorializing, but also, I mean, we're talking about, like, we don't have people, we don't want people to feel bad, so don't use the word you. That was actually some feedback from, don't use the word you, don't use the word authoritative. So some of the examples are even going way past, you know, I know we've all seen the large list of words you can't use. I'm just wondering, like, is anybody else seeing that? This is work that we're currently funded to do. And we will not we won't do work that's going to fundamentally compromise our values. Just wanting to see how widespread is this? Are people seeing any other, when you're working with the state, are you seeing any pushback, and how have other organizations been handling it? I see Sean share that new childcare voucher applications are not being reviewed until September. Sharon?
I do some advocacy work with some national organizations, and one organization actually changed. It's the Oral Health Progress and Equity Network. And what they did was they stopped writing out their full name, and it's just open. And we did an advocacy day on the Hill yesterday, and we were, depending on what offices you were visiting and going to, we were not to speak that word, equity. And so from an organizational perspective, I understand, and from an advocacy perspective, you don't want somebody to close their door on you or not listen to the words that you're saying because of the words that you use. On a more personal level, I was kind of annoyed because I felt like, well, if we're going to capitulate on something as simple as having that in the title of a name, aren't you just reinforcing all the bad behavior. And so I think it's very challenging, and I think it's even more challenging for people whose funding depends on federal and state funding, where you really, I'm more willing to, I guess I think giving organizations a pass for changing their language if it's related to funding, and less willing when people are supposed to be advocating for equity that they don't say equity.
It is quite challenging, and there are some foundations out there that are true to the equity-oriented space, and so they're going to continue because they get their monies elsewhere to use that particular language. And when certain private, organizations, nonprofits apply, they're willing to work with folks in helping them to frame it so that when they have to present this to the public forums, that it does have the language that is in alignment with this new culture that we're currently trying to navigate. But behind the scenes, it's still that culture, building a healthy community, breaking down systemic barriers, racism that impact social determinants of healthcare. So there are those particular entities out there, and there are, universities and in academia, such as Harvard, that are, wait a minute, this is what we stand for. This is our philosophy. So it's it's touchy, and I know there are other universities that are still focusing on that area of equity and community focus, but they're changing the language as such so that, again, it's in alignment with the political landscape that exists at this particular time, but with, behind the scenes, working towards, building a culture of health, if that makes sense.
Mm-hmm. Yeah, and I know I've referenced to wanting to be more of a Harvard than, some other institutions that have changed. But I do fully recognize that Harvard has a $54 billion endowment, which makes it a bit easier to weather the storm. Not every institution, nonprofit, is able to do that realistically. Are there others? So, Sean, you brought up one program that's maybe been impacted by administration, like the priorities of the current administration. I'll put it that way and make it broad and not just on DEI, because I know there's immigration and ICE things that are going on that impact the people of our county. Are there other things that, and thank you. I think because of this conversation, Health Assures like we all came together and did something about Health Assures. Are there other impacts that we're seeing in the day-to-day that are really impacting people on the ground? Maybe it's not that funding has been cut, but even there's uncertainty and so there are people maybe not receiving services in quite the same way.
Yeah,
And
I put in there because I talked to them because we have been doing for the past at least 6 months or so childcare applications for people. And I talked to the department probably about a week ago or 2 weeks ago, and they said, yeah, due to the uncertainty of future funding, they'll accept the new applications, but they won't review them until at least September. So, I mean, I just imagine that's going to have a big effect on people's quality of living. It's going to be less jobs, and it's going to affect a lot. And I know that's with what you like I mentioned, the uncertainty of everything. I just know that a lot of organizations right now are kind of taking a step back and reassessing things, and what that means for clients and families is they're not getting the services that unfortunately they need. So it's pretty tragic.
that is really unfortunate. Are there other options that we as a work group can do to address
And
that? I
sorry,
mean, there's so many problems out there. It's hard to
another thing on
yeah,
the topic of, like you said, like some organizations have the financial stability to be able to stand their ground. What scares me is, Doge's and Elon's like use of AI and how they're going to incorporate this into, I don't know to what extent they're really, and nobody knows to what extent they're going to be digging into, if it's just going to be state and count, like who knows, and just the possibility of putting language in your website that could then be, tracked by an AI automatic search or something is scary. And so, yeah, it's definitely a thin balance to walk on. And if there's somebody mentioned earlier that there's actually, I think it was you that mentioned there's actually organizations that will consult with other organizations and help them along the grant writing process, or just consult with them really. So if you know any particular ones, I think it would be good to know the names of maybe one or two, because that is something that I think a lot of companies are going to need right now. Sorry to hijack.
I'm not hijacking at all. I mean, I think I do not have a resource specifically. I think that was the goal for this conversation, just for people to be able to share, ask questions, come together with just even share common experiences. We may not be able to identify solutions. Sometimes it's good to know that you're not the only person, or they're not the only organization experiencing something. But if anybody does have any suggestions for Sean, please share. I know, Taylor, there's a question in the chat. Taylor put a question in the chat. Maybe the Horowitz Center or any other entity out there. Are there any materials out there that counter the DEI misinformation that's out there, DEIB, DEIA? Because it seems like DEI has started to become misused. Is there anything out there in a clear, concise way that can be shared? I know I constantly see it being misused in social media. And Dr. Cooper also asked if there's information regarding the proposed drug pricing model.
And mainly its implications to Medicaid and access to health for Medicaid populations.
Hmm.
And those beneficiaries, I think that's also going to be something that we can possibly look into and see how that's going to affect individuals, especially beneficiaries, their ability to access care, and will there be a disruption in their abilities to maintain continuity and coordination of services? And again, I think our group is looking at science more so than the political aspect of healthcare. We're looking at being able to provide those programs that are quality, accessible, and impactful programs, and advocate for those such programs, and look at certain platforms and avenues that we can ensure that anything that's being proposed that's going to affect and those particular domains such as access and cost. I think we should be more so aware of those so we can advocate against programs that are going to prevent us and from doing what we need to do as a work group and the providers in the communities, what they're trying to achieve as well. And I think that's the importance of a group such as this, to not only come to the table with, what's going, what we're doing in the at the county level, but also how, other particular decisions, whether it's political or whatever, will influence capacity and capabilities of being able to provide those particular services. Because again, we don't just want our folks to be able to survive, we want them to be able to thrive. And in order to do so, making sure that they have access to such programs. And so again, that's the value of such groups as this, having these open discussions and these dialogues leading to viable solutions that build sustainability and capacity and leveraging such resources.
Dr. Cooper, are you specifically referencing the administration's goal to reduce the price of drugs, that more recent
Yes,
declaration?
yeah. So I didn't know
Okay.
if anyone had, I'm just,
I'm wondering
trying
if
to look
they
over
have
that.
any information on that themselves. Sorry, this is being recorded.
Yeah, so we can do a deeper dive because again, we're looking at all those things that can influence what that's being done, and we know that are being done effectively within the county. And we know the outcomes have been improved by such, groups as our health centers. And we're already dealing with funding cuts. So what other areas are they going to cut that's going to curtail these services? And our reality is, yeah, you can cut these services and funds, but the individuals within the county are still in need of such services. So this is our time to be creative. Looking at funding sources that are maybe, like you said, outside of the federal government realm. And it won't be the same amount, unfortunately, as maybe some of the government funding, but there are foundations out there that can possibly lead to, filling or bridging those gaps, or partially for, if we are to sustain a funding cut in the health assurance programs. Sean, you had a question? You have your hand up?
Sorry for the beeping. It's our door. Yeah, just quickly, because you mentioned creative, and this is something that's been on my mind since I started working in the public health realm. I'm from Montgomery County originally, and as you guys probably know, like the Potomac area, I'm not from Potomac, but that area, Bethesda, Potomac, very, very wealthy. Have a lot of people that are making a whole lot of money. And from my knowledge, Prince George's County is pretty wealthy as well. And if we're going to be, having budget cuts and funding shortages, it's probably going to take, I don't know if we'll be into the business of fundraising ourselves at CECG, but I imagine that fundraising is going to be key in getting the support of, just local community members that are able to have those extra funds to help out their local, like their own community members. So that's just a thought.
And that is a possibility. Also being yeah, I do know that there's some mutual aid societies that have been developed for particular people, like community health workers in different areas of done that to support their fellow colleagues. I also am aware that this region is disproportionately impacted by any federal cuts. I think I heard like 25% of um, households may have had one person that's impacted by either RIFs or the reductions in forces of the federal government, may work for a contracts organization that may be impacted by. So, I mean, that is just another challenge, but I think that's maybe it still would be something that could be of benefit. We just have to figure out like what that would benefit. Um, yeah, there's tons of people who have been impacted, not just federal, but also I would say contractors and think about all the businesses that support people. Well, I don't want to, so I think there are a couple of things that we shared during this conversation. Um, it seems like many people are sticking to, those of us who shared are sticking to our values. Maybe some of that there have been some impacts to the greater population, these no jobs, of course, but also the child care vouchers are not being reviewed. I'm sure there are other impacts that we haven't seen. I know Rodrigo has shared several months ago that there was, at least at that time, there are fewer people coming into clinics because of concerns about ICE joining. So I mean, when I said DEF, these are everything that we need. So that also impacts. I think maybe if everybody's agreeable, maybe we don't spend as much time, but sharing like, okay, what are we seeing on the ground? And actually, if there's things that we need to coalesce, come around, based on these discussions, let's do that. I'm proposing to spend at least like 15 to 20 minutes at each meeting, maybe to give space for things that are happening on the ground. And so we can share if that's something that's others think that's of benefit. Dr. Cooper?
I think it's a fantastic idea. And I think, like, for instance, we have come away with some areas that we can target it, and with each meeting, come back with potential solutions. Because we are, solution based, so we can identify those problems, but let's come up with some viable solutions that can move the needle in the right direction. We may not come up with, all solutions, but those areas that we can tackle, I think that we can make it even more productive if we come back with some answers to some of the issues that have been identified.
Thank you. Thank you, Dr. Cooper. And Sharon?
It would be helpful to have a conversation or to ask CASA perhaps to do a presentation on what state level protections have been put in place and what's in jeopardy. Because they've been doing a lot of work at the state level, and I don't know if Rodrigo's on here. Perhaps La Clinica has more information, because it's hard to keep track of what's going on. And so looking at the state level and then thinking of, well, where are the gaps that the local level might fill in? I'm thinking, like if the state can't provide healthcare for uninsured people anymore, uninsurable people, it really falls to the locality. If the state can't provide certain protections that it has in the past, or has to restrict that, what's the local capability to pick up on some of that and do some of that work at the ground level? I mean, I just see, things shifting downward onto the localities to stand up for people who don't necessarily have a voice right now.
Mm-hmm. I think that's a good idea. Yeah, it is hard to keep abreast of everything that's happening. So I love that idea. Maybe we can bring in others. So I'm assuming you're talking about bringing in CASA to talk about a specific issue, but I recognize there is a lot happening at the federal level that when it filters down impacts residents and their health and wellness. Perhaps, I mean, and this aligns with, some of in our work plan, we do have space for inviting guests to talk about programs, updates. I think that aligns, because I find it hard to keep abreast of everything. Maybe if we're just bringing in and talk about, and maybe we could identify where our gaps in knowledge. And so we can prioritize who to bring in with that work.
I'm thinking out loud here, but Taylor, it might be a good idea for the overall meeting, for the larger meeting, because there are certainly policies that are impacting every work group that's part of, is to have like one session dedicated to just policy changes and budget cuts that are impacting the ability of people to provide services in this community. And You know, I'm actually thinking that there have been some changes because I work on numerous different issues. There have been some changes to where programs at like CDC eliminated its entire oral health program. You know, it just cut the entire staff for that program. They also cut the chief dental officer at HRSA. You know, I mean, there are places where there are large changes happening within administrative agencies that don't make it to MSNBC or any other headline, you know, any other news source that we're seeing these days that have tremendous implications for service delivery.
Sharon, you have a crystal ball. Our June 10th, our quarterly meeting that's taking place, our coalition at large, that meeting taking place on Tuesday, June 10th, will actually focus on policy updates. So my colleague Stephanie Little, who many of you have already met, our chief of health policy and innovation here at the health department, is going to do a legislative update. So she's going to be talking a lot about the local level policies, some state level, and of course at the national level as well. And then talking about budget cuts. Hopefully by then we'll be able to present the final fiscal year 26 budget. So if you all have, you know, any specific policy areas, any specific policies that you would like her to discuss in depth that you think would be impactful to talk about as a coalition at large, please feel free to email those to me ahead of the meeting. Again, that'll be taking place in the evening in person on Tuesday, June 10th, and I will be sure to send out the information about that event. And I saw Rodrigo, you came off mute a few seconds ago, so I wanted to give you space as well if you had a
No. I think it was pretty much summed up by both Christine and Sharon. I mean, no, I don't have anything to add. I think maybe adding CASA, the only thing I could consider if there's a possibility, national associations. I don't know, for example, the National Association of Community Health Centers could be a good, I know their policy team does weekly calls to keep you abreast of all the cuts going on. I don't know at the national level if there's other ones that could give that bird's eye view of everything that's planned to disappear, cut, or I'm trying to use the words carefully, but like, and in terms of the immigration landscape, I agree with Sharon as well, because it's equally it's too fast to keep up sometimes. So, but yeah, CASA, I think National Immigration Law Center could also be a good place to for grounding big picture analysis.
So,
Thanks,
sorry,
Rodrigo.
Rodrigo, did you say National Center for Community Health?
It's the National Association of Community Health Centers. They keep track. We join when we can in their weekly phone calls of the shifting federal landscape. And since it's very closely related to primary care for us, it's been helpful, but it's too quick. Sometimes we can't join, and but having a dedicated, maybe have two buckets, right, on or three big picture. I mean, maybe federal, local. I thinking out loud here, so I would need to brainstorm with you all and together.
Thank you for sharing that, Rodrigo. Does anybody know of any state level agencies that are convening any policy meetings like that are similar? So state level associations.
What about NACHO, the National Association? I forget the CHO, county health,
city and county health officials. Yeah.
Would they be a good
for our account for our state?
No, for county, for local, but yeah, seeing what's going on. I don't know about state, but
they may, yeah, possibly. Yeah, I was trying to figure out if I know a lot of national organizations. I was just wondering if there's anybody on the Maryland level specifically that's tracking the specific impact on Maryland. I know Families USA does a great job of providing dashboards that you can drill down on. All right.
I guess from the state at Maryland, I think the Medicare for All. I don't know if they'd have the chapter at Maryland with Stephanie Clapper. I don't know. She helps us sometimes with understanding what's going on at the state level. I don't know if you all have connections with them. Nope. So I could connect offline, and maybe if it's helpful, I could reach out to her and maybe obviously with your guidance and orientation, invite her.
Thank you. I think it sounds like there was going to be something at the quarterly meeting, so I can't speak for what was already planned.
Okay.
Taylor,
Yeah, perfect.
If you think that would be beneficial for the quarterly meeting, certainly. I mean, I'd personally be interested in knowing who I could follow along or is doing things on a regular basis at the state level. So I know we've had a lot of discussion. We only have 15 minutes, Taylor, and we had just one or two other things. I don't want to cut this discussion short if we need time.
I'm gonna go ahead and transition us. We have some good next steps. Just to keep in mind, our June meeting is going to be canceled in observation of Juneteenth. So we will reconvene in July. During that July meeting, I did want to give space. Some of you all who have been around for a few months have previously interacted with Team Black Mamas Matter. They are a research group out of the University of Maryland, and they've been a leader in maternal health, researching the maternal health crisis here in Prince George's County. So they did go ahead and wrap up all of their results. They were able to interview and survey so many of Prince Georgians recently pregnant and pregnant individuals. And so they want to share their results at an upcoming health equity work group meeting. So I do want to give Sohei just a quick minute to give a really quick overview of what they were able to capture during their study to reorient us. And then we will take a deeper dive at a future health equity work group meeting and take a look at their results and see if there are any results or anything that the work group would want to take on in particular in terms of the recommendations that they have. So Sohei, I will go ahead and stop sharing my screen so you can give us a quick overview.
Okay. Okay. I want to hope this works. Can you see my screen? Okay. So I'll keep this very brief. I think what I might end up doing is sending the slide for feedback because I do have some questions at the end. But like Taylor mentioned, my name is Sohei, and I'm here presenting kind of on behalf of my Gemstone team, Team Black Women's Matter. This is kind of the overview of the presentation. We're not going to get through all of it, so I think I'll just do the introduction, talk about the research problem a little bit, and then research questions, and go straight into the discussion because I do have some questions at the end. So just for a brief overview of who we are students at the University of Maryland. We are undergraduate students and we're actually graduating next week. So one of the things that we prioritized a lot during our research was really getting engaged with the Prince George's County community and attending the Health Action Coalition meetings and the Health Equity Work Group meetings. So we want to bring back and share our results back to the work group to see how this could help improve the maternal health landscape in Prince George's County. A little bit about Gemstone as an honors program. So it's a 4-year undergraduate research program. So we had the opportunity to do this research on Black maternal health through our honors program. For a sense of a timeline, we where IRB approved. A lot of the fall was for participant recruitment. So we came to these meetings, we tabled at a lot of events and just got the word out about our research. And now it's spring 2025. We've analyzed our data, we have results, we have recommendations, and we've also published, well, no, okay, wait, no. Let me rephrase that. For our program, we need to complete a thesis. So we've completed our thesis for the program, but it is a rather large document, it's like 100 and something pages. So one of the things that we've been thinking about is how to condense the results to make it more accessible to the general public. Brief kind of understanding of the maternal health landscape in Prince George's County. There are 4 hospitals in the county, but only 2 of those have birthing centers. And then you also can see from this table here, there's a huge disparity in the rate of deaths for Black non-Hispanic women compared to others in Prince George or in the state of Maryland. And then University of Maryland Medical System and Capital Region is in Largo, and MedStar Health is in Clinton, which are like very close to each other. So there are regions of Prince George's County that do not have access to a birthing center. One of the things that we talked about was comorbidities, but primarily for our research, we focused heavily on provider trust. So as a mother, do you feel like you can trust your provider? But also the lack of cultural competency training that providers are getting in their medical school training, but also just in their formal training for the degree that they did receive. These led us to our research questions, which looked primarily at the primary barriers that Black mothers face in Prince George's County, and also how implicit bias shapes patient-provider interactions. This is a very brief overview of our methodology. We had surveys and interviews. We were able to, and like, we're able to survey about 68 mothers and then 102 or 120 providers. And these are like some of the questions, some of the things that we wanted to find out from them. And we used R to analyze our data and also qualitative, just like thematic analysis for our qualitative research. And these were the eligibility criteria. And I would like to stop here and say thank you so much for your help as a work group in helping us get the word out about the survey. One thing I wanted to highlight was that we were able to go to a lot of community events, such as attending the Health Action Coalition meetings, but also read like it was a Dr. Seuss thing at the community center, and also tabling at a lot of the health fairs. And this was at She Rises in Oxon Hill. They had a community baby shower that was really exciting to attend. So I'm going to shift into, I'll do like the first page of our results from our mothers. So like I mentioned, 133 people filled out the survey, but only 69 of those were eligible because they had to be in Prince George's County to count, but the Qualtrics form did not filter for responses. And this was kind of the overview of the people who filled out our survey. Most of them had a bachelor's degree, were relatively comfortable financially, and primarily in their late 20s. And also for about 45%, this was their first pregnancy, but for the rest, they were postpartum. And something interesting is that 100% of our survey participants for mothers did have insurance. And this is representative of Prince George's County demographics from the Maternal and Infant Health Report. So that was really cool to see just like the congruency within that. A lot of our respondents were from the southern part of Maryland, but also rural, which is over here, which was interesting because this is a graph that shows the births in the county, and we actually see that there are less births happening here in the southern part of Maryland, but that wasn't reflected in our results. So I'm going to actually just go back to the providers because I do want to get to my questions. These were the providers that we were able to survey. Something to note is that the sole information we asked was what they did within the maternal care space. So we had a lot of OBGYNs,
some physicians, some doulas, and then we had the other option, which included medical students as well, and also some perinatal or a perinatal mental health clinician. And we asked about cultural humility training, and this was the definition that we use for that. About 81% of the providers reported having cultural competency training. And if you look at, we did the breakdown by profession type. OBGYNs were the most likely to have gotten training, but doulas and certified nurse midwives were actually least likely to have received some form of cultural humility or competency training during the course of their like the rigor or the course of getting the qualifications that they need to do the work that they do. We also asked about the length of provider training, and you can see here that most of our respondents said 2 to 5 days, but we also asked how long it had been and how long it had been since they completed their training, and most of the respondents said over a year ago. We asked if the providers felt that the cultural humility training that they received was adequate. And even though about 42 of our providers said yes, they felt it was adequate, when we asked them what are some challenges that you encounter when delivering care, you can see that the second most chosen option is inadequate cultural humility training. So there was that discrepancy in what they were initially saying versus what they actually felt was a challenge to them. We also had a bias test, and I'm just going to, you can like take a moment to look at the slides. This is supposed to be all red, but you can see here that we are getting a significant, like 1/3 of the participants answering incorrectly for the bias statements that we did ask. And when we break that down by provider type, we can see that mostly doulas, certified nurse midwives, OBGYNs, and then a few family medicine physicians and nurse practitioners were answering incorrectly for the bias statements that we had looked into, which is really shocking, primarily for doulas and certified nurse midwives, because I know that given the knowledge of the maternal health crisis, a lot of women actually go to doulas and certified nurse midwives to get more of that personal advocacy. But it seems like the doulas and certified nurse midwives are not well equipped to handle interacting with patients from a different background than them. Most of the providers that responded to our survey said they spent about 30 or more minutes with their patient. So they, even though they had mentioned like lack of time to get to know the patient, it seems like generally they are spending a decent amount of time with the patient during a doctor's appointment. We also had interviews. One thing to note is that all our interviewees for medical providers were Black women, which definitely some interesting themes came up as a result of the race of our interviewees. And these are the kind of professional backgrounds and where they practice or went to medical school as well. The themes that I wanted to highlight was the trust and racial concordance in care. A lot of providers, or the providers that we did interview, said that they felt like their patients were a lot more relieved when they saw that their provider was the same race as them, which is congruent with what we found out with the mothers seeking medical care from a provider that looked like them. But something that was interesting was this idea that their lived experience as Black women played more of a role in how they interact with their patients compared to the cultural competency training they got during medical school or their residency. And just highlighting the mental health piece, which is something that was a strong theme in conversations that we had, but we did not explore in our research because that was not our scope. But the idea that you're postpartum from from when you give birth till the day you die. And these are the main themes that came up that I did want to highlight. the racial concordance with providers, a lot of the mothers said that they shared their same racial identity as the provider, and 52% of those mothers then reported that it had a positive impact on their interactions or their birthing experience. And this is congruent with the quotes we were getting from our interviewees, as you can see kind of at the bottom. The other thing was the perceived attentiveness to care. So about 46% of mothers felt that their providers were never attentive to their concerns, while only 30% felt that the provider was always or frequently attentive. And this was really supported by an interview that we had with an OBGYN who said she had 2 patients scheduled for 1 o'clock and then 2 for 1:15. It's like she doesn't have enough time. She actually interviewed with us during her lunch break because she doesn't have enough time to even set aside like 30 minutes to just talk to us as a team to get to know more about the work that she does. And then the last thing is there's a lack of standardization within cultural humility and the types that different medical providers have to take. And also, just generally speaking, doulas and certified nurse midwives are less likely to have completed any form of cultural competency training. There's a critical gap in knowledge that could actually affect the delivery process or the types of care that Black mothers are getting. And also for the providers, they felt that their work environment was quite rushed. And I am ending here, but leaving with these questions. This is something that the team has been thinking about as we have completed kind of the academic requirements for our program. We did want to really emphasize that community engagement piece, and we were wondering what are like ways that you typically receive or review research findings, especially if they're intended for a more general audience. So it's basically, how would our results be beneficial to you in the work that you do? And also, if there are any community organizations or partners that you know that would benefit from the findings of our research, we would love to get in contact with them. And special thanks to all the people on the slide. Thank you all from the Health Action Coalition. It's been a pleasure getting to attend all the meetings and some of the in-person meetings and getting to know more about the health landscape of Prince George's County. And I did have our contact information here as well, if you would like to email us with any of the answers to these questions. And I can also send the slides to Taylor so she can share it with you as well. Let's see. I'm going to stop sharing my screen for the best.
Thank you so much, Sohei. And certainly, as I mentioned earlier, if the work group is interested in a more in-depth presentation to go through a little bit more about the study participants, the methodology, and more of those results, we can certainly schedule a meeting during the summer months. But curious if anyone has any initial reactions to the questions that Sohei posed to the group about how you consume research, and then any other interested groups in your network who may be interested in receiving this work.
And then question 2. Oh, and I also put the email in the chat as well. One moment.
It seems like the organizations in which those providers that received the result that were surveyed could benefit from the findings of your research, and the providers themselves, and others doing the work in that space, the birthing centers in this area.
Hi, this is Judy. I was wondering, I put the question in the chat. Are you aware of the MDPQC, the Maryland Prenatal Quality Committee?
I've heard of a committee that was being formed for maternal health. I think this was it would have been at like the earliest meeting we had this year, but I don't know if it was formed.
It's been going on for years.
Oh,
It's been going on for years, and so just if you look up the MDPQC or Maryland Prenatal Quality Committee, I have to
okay.
make sure I get them in the right order. But it can get one is that they may be very interested in your research, but two, you might find their information very interesting and very helpful.
Yes, because I want to, or like we as a team want to, because the research that we got is it's very exploratory. We're just trying to get a feel of the maternal health landscape in Prince George's County, primarily the experiences of mothers who reside in the county. So trying to see how then could that be applicable to some of the departments, organizations that are providing health services to the populations that we did um, interview and survey.
Yeah, definitely talk to them, or and reach out to them. In Prince George's County, they work with all the hospitals too.
Okay.
So it started out with being hospital centric. They are trying to also now have it be have FQHCs part of it too. But it started with the Maryland Department of Health. The organization that I work for, HQI, we are the facilitator of that work here in Maryland.
Okay.
Okay.
FQ.
But you don't have to worry about HQI. Just look up MDPQC because that's
Okay.
really and it's about everything across the state. So take a look. I mean, they have just really, really great resources there.
Yes. And then, oh, one thing that I can also do, because we did present this research to our honors program, and it's kind of like going through all the slides and all the results and the discussions in a lot more detail. And I made a Google Drive, and I can actually put the link to that in the chat and also send it to Taylor as well. That goes over the presentation, but in a much longer time and actually not as rushed as I did today.
Okay.
But yes, I did just put the link to the drive in the chat that has the recording from the presentation that we gave for our honors program. Oh, I saw the link that you put. Thank you.
Wonderful. Well, thank you so much, Sohei. Really appreciate you continuing to interact with the work group and bring these results back to the work group. We certainly look forward to reviewing your findings more in depth. And then you've got some interaction here in the chat. So I will be sure to follow up with you about some contact information. But folks, the email there to reach the Gemstone team is in the chat if you would like to reach out and schedule a presentation.
Yes, and then please, one of the things that we as a team will be working on kind of, because we're all graduating this semester, so for the next week or two, it's just focus on graduating, but over the summer, we want to create an executive summary that provides more of a briefer introduction to the research, but also our results and hope some recommendations that are pertinent to the different populations that we spoke to. So mothers, but also the different kinds of medical providers there were, and then to health departments / health organizations that are working in the maternal care space.
Thank you so much. Yeah, I can imagine the executive summary and one pagers, anything that is digestible to get all this information in one place. I'm sure that will be greatly appreciated and something that we can all take back to our organizations as well.
Mhm.
And a huge congratulations on your graduation.
Thank you.
Alrighty, well, I see that we are over time. I just want to share with you all 3 quick announcements that I will attach in our meeting notes. So Sean had to jump off, but from our folks over at the Community Engagement and Consultation Group, they have a few summer events coming up. So a pop-in Fridays to get connected with some different resources to address your social needs, as well as the Harvest of Loaves. This is a food giveaway that's going to be available Monday through Friday from 10 a.m. to 2 p.m. So I will share these flyers with you all to share with your organizations and your networks, and to hopefully assist anyone who could use the resources. And then next, save the date. I will share this invite with you all next Thursday during our community care coordination team meeting on Thursday, May 22nd at 11 a.m. We're having a presentation from Just Neighbors. Just Neighbors is a 501c3 that provides immigrant communities in DC and Maryland and Virginia, and they will be coming to specifically talk to Prince George's County providers about immigrant rights and legal resources that are available in the community. So this is a very important training. Please share it far and wide with your networks. We hope that this will be a useful training, and we will also record it and be able to share it with you all afterwards, so more providers can access this training. And then lastly, from our friends over at the American Heart Association, there's a Rural Health Summit taking place on June 13th in Arlington. I'll be sure to share the registration link with you all for anyone who is interested. And to close this out, the June Health Equity Workgroup meeting is canceled again in observation of Juneteenth. We will reconvene back in July. But as I mentioned, also save the date and be on the lookout for that registration link to register for our in-person quarterly meeting for the coalition, taking place on Tuesday, June 10th from 6 to 7:30 p.m. at the Parks and Rec Administration Building. Any community updates before we close out?
Oh, packed meeting. Thank you for the discussions today, everyone, and enjoy your evenings.
Thanks, everyone.
Enjoy your evening. Goodbye.